Today, we're going to crack the code on a hidden language that, believe it or not, powers our entire healthcare system. We're talking about medical coding.
You know that moment, right? You're looking at a medical bill and you just see this jumble of letters and numbers next to every single service. Well, it turns out those codes aren't random at all. They're part of a massive, super intricate system. And today, we're going to pull back the curtain and see exactly how it all works.
So, first things first. When we say coding, I want you to get any idea of computer programming out of your head. This isn't Python or C++. Nope, this is a completely different kind of language, one that's all about translating every little detail of our health.
At its heart, medical coding is really just a translation service. Think about it. A medical coder takes all the detailed notes from a doctor, basically the story of your visit, and they convert that whole narrative into a series of standardized codes. These codes can be understood by anyone in the healthcare world, from the billing office down the hall to a researcher on the other side of the planet.
And here's what that looks like in the real world. A diagnosis, like diabetes mellitus, gets translated into the code E11.9, or a surgical procedure, like a carpal tunnel repair, becomes 64721. Every single thing, every condition, every procedure, every service gets its own unique code.
So, you might be wondering, why have this super complex system in the first place? You're probably thinking it all comes down to money. And, well, that's a big piece of the puzzle for sure. But the real impact of these codes goes way beyond just your medical bill.
Medical coding really has two main jobs. On one side, yes, it is the absolute backbone of billing. These codes tell insurance companies exactly what was done so they can pay the doctor or hospital correctly. But on the other side, and this is huge, it's a gold mine of data for public health. And this data is incredibly powerful. We're talking governments using it to project budgets for massive programs like Medicare, researchers use it to track how diseases are spreading, or to see how well certain treatments are working. It allows them to compare things like the health outcomes of a smoker versus a non-smoker with the same illness. It is truly the engine behind modern medical research.
Okay, so if coders are translators, what are their dictionaries? They can't just be pulling these codes out of thin air, right? Of course not. They use a very specific set of official reference books.
The main players are these code books. You've got the ICD-10-CM for diagnoses. That's the book that answers what is wrong with the patient. Then you have CPT for procedures, which answers the how or what was done about it. And then you get even more specialized books for things like inpatient hospital procedures, equipment, all the way to separate books for dental work and mental health. It's a whole library. And here's something you've got to keep in mind. This field is always changing. These code books are updated every single year. New medical technologies pop up, old procedures get phased out, and the codes have to keep up. So for a coder, the learning never really stops.
All of this might have you thinking, what's it actually like to be a medical coder? Well, let's take a look at what the career itself is really all about.
First off, let's talk numbers. The average salary for a medical coding specialist is typically in that $40,000 to $50,000 a year range. It's a solid career with plenty of opportunities to grow and specialize.
Now, the job itself has this really unique balance of perks and responsibilities. On the one hand, a lot of coders get to work from home, which they've been doing long before it was the cool thing to do. It's also a non-patient-facing role, which is a big deal for some people. But the flip side is that it requires intense focus. You have strict productivity goals, accuracy has to be nearly perfect, and you're bound by serious patient privacy laws like HIPAA. For a lot of coders, though, the real appeal is the puzzle solving. It's kind of like being a medical detective. You're sifting through these really interesting and complex cases, piecing together all the clues to find the exact right codes. It's a problem solver's dream.
And where do these medical detectives actually work? Well, it's not just in hospitals. Many of them work in doctors' offices, for specialized billing companies, or for insurance companies. You can even find them in some pretty unexpected places, like law firms, where they help figure out if there's been any funny business with medical billing.
Now for the big question, the one that's on everybody's mind these days when you talk about a data-heavy job like this. Will AI and automation make medical coders obsolete?
And the short answer from all the experts in the field is a resounding no. See, automation and AI have been part of medical coding for years now, but they work as tools to help coders, not to replace them. The job isn't going away, but it is evolving. The focus is just shifting more towards handling those really complex cases that a computer just can't figure out on its own.
So, if after all this you're sitting there thinking, hey, this actually sounds pretty cool, you're probably wondering, how do you even get started?
Well, here's one of the most exciting things about this career.
It's accessibility. You often do not need a 4-year college degree. Success in this field is really built on getting some specialized training and, most importantly, earning a certification.
And the path is surprisingly straightforward. You can start by looking into programs at community colleges or business schools. Or you could go straight to the source and get training from major certification organizations like the AAPC or AHIMA. Then, once your training's done, you've got to pass that big certification exam. That's your key to a whole new career. So, as we've seen, medical coding is so much more than just numbers and bills. It's this really fascinating world where medicine, data, and finance all intersect. It's a chance to be the one who pieces together the puzzles that keep our entire healthcare system running. So the only question left is, could that be you?